A critical incident has been declared at hospitals in Nottingham. This is a serious thing in response to what officials call extreme pressures across all its services. So the question is, what are these extreme pressures? Is this COVID? Is this lack of staff? Nottingham University Hospitals Trust said that some patients had emergency waits of 36 hours just on Monday. Dozens of patients lying, usual story, trolleys in corridors.
Well, GB News' Midlands reporter Jack Carson is at Nottingham Hospital for us this morning. Jack, this is very concerning given it's 1st of November. I mean, we often hear about hospitals feeling winter pressures, don't we, and all the sort of provisions being made, sometimes tents up in car parks and the like. But this is very early on in the season to be having this kind of crisis.
It is, of course. You'll know as well as anyone does around this country that particularly during the height of the flu season that emergency departments can become particularly overwhelmed as vulnerable people possibly come down with illnesses. Naturally in winter, people immune systems aren't as strong, and so those emergency departments, those wards across hospitals across the country do become overwhelmed. And of course today, with Nottingham Hospital declaring, of course, the first major incident of the winter season, the first hospital in the UK to declare this incident. Of course, it is concerning as pressures do increase over the coming months, how other hospitals, which may well be in a similar position to this one, do cope. I mean, yesterday, of course, Nottingham put out that statement saying that the critical incident had been declared here. They said that their emergency department at the Queen's Medical Centre here was undergoing sustained pressures, and they're asking the public to think wisely before they attend. Of course, some of those emergency departments, lots of those patients may well not necessarily need to be in the emergency department. That's certainly what Nottingham Hospital were trying to push people towards, in urging people to only come yesterday evening if it was only necessary, urging people to call 111 and use other urgent treatment centres around this city in order, of course, to make sure that those pressures don't continue to build up, and so that they can see the patients in the emergency department that are most necessary and critical to be seen. As you mentioned, Eamon, 36 hours some patients were waiting on Monday evening, and that critical incident still remains here today. And of course, as well, we know it was admitted that there was an IT problem, but that they think has now been fixed. That was, a spokesperson of the hospital said, adding to delays to patient care. And they've said that we've now reverted back to our standard offline processes, and acknowledged that there may have been delays because of the way that they were working in that way. And they apologise for any convenience caused. Of course, this hospital, as well as others, are still calling for people to call 999 if you do need that emergency care. But if you are going to A&E, the hospital urging to think about other things like treatment centres, other things like 111 to ease those pressures on this hospital as it tries to recover from that incident today.
Jack, thank you very much indeed. Goodness me, you couldn't make this up, Jack. People already facing so many delays and things like that, and yet this again on top of it. What state is our health system in? And then we don't even talk about the care system. Just let's not mention the care system.
Also the staff in all of this, so demoralising to see, you know, that number of patients realising you can't give them the kind of care that you want to give. No wonder there's burnout, there's people leaving the profession not wanting to stay in it.